Let's go to our first caller from La Jolla.
Dr. Larkin, my name is Darren. I'm calling from La Jolla, California. I have a friend who was recently diagnosed with prostate cancer, and it seems like he's been getting a lot of different advice, some of which is contradictory, and I think he's having a hard time sorting it all out. I was wondering what advice or what you would have to say to somebody who was recently diagnosed with prostate cancer. Thank you.
Darren, this is really a great question that I'm sure many of the listeners would like to hear. What is my approach to somebody who was just diagnosed? So the first point I would like to make is do not be afraid. It's very scary to hear the word cancer and you think that it happens to somebody else, but when it hits you hard. And when you are afraid and scared, it's very hard for you even to hear what a doctor is telling you, or it's very hard for you to make any decision. So number one, don't be afraid. Now, the second point I want to make is that you have to recruit all your resources before you deal with it. And your resources start with your own family. Don't be shy and tell the people close to you, your wife, your children, your friend, your family. Tell them about what's happening to you. You'll be amazed how much they will help you to go along with dealing with this disease. Don't go alone, and you are not alone. In that sense, I would like to tell you also that one of the first things you have to do for yourself is to find a local support group in your neighborhood. This way you'll meet other people that have the same disease like you, and then you find out that you are not alone. You may find some friends there from your hometown that have the same problem, and you see how they cope with it, and you will learn a lot from them. So you are not alone. So I very, very much recommend that you look for a local support group, and if you need any help, you could call our foundation and we'll let you know where you have a local support group in your hometown. The main point is not to rush to make any decision. You should never make a decision only because you want to get it over. You make a decision in order to do it right, and it has to be your decision, not somebody else, your own decision. But out of the fear that what will happen if I'm waiting, what will happen to the cancer? And I'll tell you right now, there are treatments that you could take that are temporary, reversible, and are not that bad, that in case you are afraid the disease is progressing while you are deciding what to do, you could take these temporary measures in order to hold things at bay. What you have to do, and it's very hard, you have to study all your options. But I have to warn you, you have to study all your options, not only what are the options of the treatments, but you need to understand also what's going on with the risk associated. So basically, when I use the word risk, you have to look through the eyeglasses of risk assessment. You have first of all to assess what is the risk of the disease. What happens if I do nothing? Can I wait? So you need to assess the risk of disease. There is a wonderful table by the name Albertson table that could tell you, according to your age, according to your PSA, according to your glycine, what happens if you don't do any aggressive treatment, what is the likelihood of survival 15 years later from the disease or overall survival. And this is very important to know before you jump into any treatment. So you need to do a risk assessment. I highly recommend that when you go to see the different doctors, it's so hard for you because you are very emotional. Take your wife or your brother or your friend and take a tape recorder with you, because maybe only 5% what the doctor is saying, maybe you retain it. So record it, and when you go home you have to listen again and again. There are no shortcuts here about making the decision, and nobody could make it for you. You'll have to make it for yourself. But I strongly recommend that you write a little diary with the date, whom did I see and what date, what did he say, what test I have, and run your all medical records. Our foundation could help patients that want to run electronic record by getting on the internet and having a Medigraph, but that for another time we'll talk about it. So what is my overall philosophy about how do you sort out through all these treatments? You have to understand that after so many years that I help so many patients with so many different kinds of treatments, my conclusion is this, that overall all the treatments are about the same. You have to feel comfortable with whatever you choose, and you have to understand each treatment, what are the side effects and what's going on with those treatments. Very important point is also not only what kind of treatment you choose, but who's going to deliver that treatment. My philosophy overall, and I'll sum it up here, is this. I recommend every patient like you to adopt to himself the minimum intervention that he feels comfortable, not your doctor, that you yourself feel comfortable. And if you feel comfortable with this approach, then go ahead and with your doctor and go ahead and do it. But the issue is, what do you mean minimum intervention? Well, there is another side to the equation here, and that's the other side of it is maximum surveillance. You need, as part of the initial assessment of your disease, to find out where is the disease, how aggressive the disease is, what are the imaging tests showing you, what are the tumor markers will show you. That will help you to sort out to make a decision, but more important, that will be a baseline for the future to monitor how successful it was you are doing. I have a famous sentence, people like it, which says, the line between a hero and stupid is very, very fuzzy. So the less you do by intervention, the more I think you need to do all the testing to make sure that the window of opportunity to control the disease is still open. So thank you, Darren, for your question. It was a bit longer here, but I thought that other people may enjoy listening what is the overall approach. Don't be afraid, educate yourself, don't rush, run together with your family, you're not alone, go to support groups, and try not to hurt yourself by the treatments when it's not necessary, because most of the time the disease will not hurt you.
Thank you for listening to Ask Dr. Barkan, a free service of the Prostate Cancer Research and Education Foundation, brought to you every Tuesday evening at 6 p.m. Pacific Time, 9 p.m. Eastern Time. We hope you'll visit us next week. If you or someone you know has a question about prostate cancer or any men's health issue, remember to call in before the next show and pre-record your question. Dr. Barkan will answer your question during the next broadcast. Thank you. Live well.